Good evening, students, and welcome to my channel. So today we will discuss about the various factors that cause delay in the wound healing. So as in the first stage of the wound healing, that is the inflammatory stage, we have discussed that how important that the healing process is. So for a surgeon, it is a very important that healing should take place in a time without producing any complications. If surgeon has done something meticulously, if the healing does not take place, that means the total failure of the procedure. So today we will discuss the various factors that are responsible for the delayed wound healing. So we can divide these factors into the systemic factors which are present throughout the body and the local factors which are present at the site of the wound. So first we will discuss the local factors which are present at the site of the wound. So these local factors, first is the infection. Presence of infection, presence of pus will cause the delay in the wound healing, because the pus will inhibit all the stages of the healing process. Second is the presence of foreign body. So if the foreign body is present at the wound site, that foreign body may be received from road traffic accident, civilian trauma, or sometimes what happens when the person is any technician or a doctor is changing the dressing, so some threads of the gauze piece may remain in the wound. One thing. Second is sometimes what happens, the subcutaneous sutures that we apply, so these sutures take time for your disappearance if these are dissolvable sutures. So until unless we remove these sutures which are acting now as a foreign body, the wound will not heal. Third is the continuous, you can say, the movement at the site of the wound. If the person or a patient is not able to provide the rest at the site of the wound will not heal, or it will heal in a very slow pace. So rest is most important thing that we have to give to the proper healing of the wound. The next point is the tension at the site of the wound. Tension at the site of the wound means, suppose these are the two margins, and when the patient is under anesthesia, everything is relaxed and we have stretched the tissue and sutured like this, but there is lot of tension at the site of the wound. Ultimately what will happen, these sutures cut through to the margins of the tissue. So ultimately what will happen, wound will gape and there will be no healing at all. And after the gaping of the wound, either we can give some relaxation incision at the side of the wound so that the margins can be approximated, or we can let the wound heal by the secondary intention. So these are the local factors which are responsible for the delayed wound healing. So now we come to the systemic factors. As we have already discussed that there are many raw materials which are required for the healing of the wound. If any of these raw materials are absent or decreased in the quantity, so these can hamper the healing of the wound. The wound may not heal at all, or there may be delay in the healing of the wound. So what are those factors which can cause, systemic factors which can cause delayed wound healing? So first of all, we will discuss the various raw materials that are required for the healing of the wound. So for any scar tissue, we should have a good quantity of protein in the body, and this good quantity of protein, amino acids, give rise to good quality of collagen fibers which are responsible for the formation of scar tissue. So protein deficiency is one thing, and the deficiency of your elements, that is zinc and the iron. So these two elements are essential for the conversion of immature to mature collagen fibers. Then is the vitamin C is also responsible for the conversion of immature to mature collagen fibers. So vitamin C deficiency can also cause the delayed wound healing. Then are the various drugs that can cause delayed wound healing, like your steroids. If some patient is on steroid, that may be because of autoimmune disease, maybe allergic problem. So these steroids can cause the delay in the wound healing. Then are the chemotherapeutic or cytotoxic drugs which the patient is taking for the malignant problem, malignant disease. So these cytotoxic drugs will cause the delay in the wound healing. So then are your systemic diseases that can cause delay in the wound healing, like your jaundice. That jaundice may be because of any cause, and the excessive amount of the bilirubin in the body can cause the delayed wound healing. Then other systemic cause, that is the diabetes mellitus. This diabetes mellitus is responsible for delayed wound healing by continuously increasing the concentration of the blood sugar level if the sugar that is not controlled with medication or the insulin. Second is it can decrease the immunity of the body, and other, you can say, it can cause neuropathy and the vasculopathy. In case of vasculopathy, the blood supply to the injured part or the wounded area will be decreased, and the raw materials which are required may be reaching to the site of injury in a very slow pace. So then are the radiotherapy. If the patient is having some kind of malignancy and is receiving the radiotherapy near the site of the wound, so that will cause the decrease in the healing process. So how radiotherapy affects the healing process? First, it will cause the fibrosis of the local tissue. It will cause the damage to the vessels or capillaries near the site of the wound. In this way, the nutrition will not reach, the area will be less vascularized or avascularized and more prone for your delayed wound healing. So these are the factors. And the other disease, that is the tuberculosis. This tuberculosis can also cause delayed wound healing, specifically if the wound is caused by the, you can say, the tubercular bacteria. Suppose if some infection occurs or any injury which is infested by the tubercular bacilli, so that wound will not heal whatever we may do. So unless we start the anti-tubercular drug, the wound will never heal. Though it may decrease in the size, it may shrink, but some amount of wound with thin watery discharge will always remain there. So these are the common factors that can cause your decrease in the healing. And one more thing, that is the malnutrition. So this malnutrition occupies all the things, that is the deficiency of proteins, minerals, vitamins and other raw materials. If the patient is malnourished, so these are the things, if we know that these are the diseases and these are the local factors that can affect the healing of the wound. So if we know beforehand, before surgical procedure, if the procedure is not an emergency procedure, so we can rectify that in the preoperative period as well as in the preoperative period by providing the good nutrition to the patient, removing the infection, treating the systemic problems. So in this way we can enhance the healing of the wound, and this proper healing of the wound lead on to successful surgical procedure. Thank you very much, and keep watching the next episode so that you can have good knowledge about the subject in a very simple and lucid language. Thank you very much.